This episode of the Operatory podcast is brought to you by Opera VR Digital Nitrous, the immersive patient anxiety melting experience, proven to be as effective as nitrous oxide with no drugs. True drug-free sedation with Opera VR. Go to digitalnitrous.com. Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, providing the very valuable patient perspective is my man, David Pryor. How you doing, man?
Brian Laskin. I'm doing great. How are you?
I'm doing great. And I'm very happy again, as always, to have the patient perspective on this important podcast.
I am happy to provide.
Well, today, what I want to talk about is from how dentists can communicate the value of certain technologies to their patients.
Okay.
So I would, you'll obviously have a great perspective on this. And I know that it's a challenge sometimes for dentists and dental teams, not just dentists, but hygienists and assistants particularly, when they have a patient in the chair and they just bought this cool technology that we're all jazzed about, that transforms the patient experience, makes our clinical care better. How do we communicate the value to a patient? Because if you say, let's take for our first example, CAD/CAM.
Sure.
CAD/CAM dentistry.
Yep.
You, as we've mentioned on the podcast, have CAD/CAM restoration numero uno from Dr. Brian Laskin in your mouth. Yes. And you, my
Mountain
friend,
Dew has not been able to defeat it yet.
Not yet. You're trying hard.
I try very hard.
Yes. Kudos to you, man.
Thank you.
And also kudos to me for having it not fail yet. Yet.
How long has it been?
Oh, man. I bet
it's
it's
about
been
15.
Oh, it's more than that.
Really?
It's more like 17 years.
17 years.
17 years, yeah. So I think you would be, it's a BOL inlay, number 3, as we've discussed before.
Yep.
Took me 4.5 hours to do.
Yes, it did.
4.5 hours. Today, that would take me about 30 minutes.
Mm-hmm.
Yeah, and it's not just the technology that's gotten better. Let me put it that way. But explaining, if you spend $150,000 on this equipment,
Yeah.
beautiful technology,
Yeah.
transforms the way we deliver care.
Yeah.
But I think it's not necessarily obvious how we should talk to patients about CAD/CAM dentistry. Because there's going to be like 5-10% of the patients that's like probably like you and me, and frankly like most dentists, where we're technical or engineering mindset or nerds that like just like the technology for technology's sake.
Yes.
That we want to learn how this happens.
Mm-hmm.
And I think the mistake that a lot of dental teams make is we go directly there because that's where we are.
Mm-hmm. Yeah. Yeah, that makes sense. I think that's one of the reasons that I actually enjoy speaking with dentists when I talk to them as part of my job, because they're nerds just like me.
Yeah.
Yeah.
And we all see us engineering mindsets,
Right.
see things the same way, and we want to just see how everything works.
Yeah.
But most people, for example, my car, the car with an engine,
Yes.
most people just want to have, it's just the magic box that I want to have work.
Yes.
They don't want to know about the pistons and the compression and the, everything that goes into it. And whereas I'm one of those, the dinosaurs that's like, you can't work on your car anymore because all these newfangled computers, right? So most people don't want to know what's under the magic box under the hood, what keeps their car going, right? And it's similar with dentistry. They don't really care about the steps that you go through to create your clinical outcomes. They're really looking for what's in it for them.
I was just going to say that. That's the old sales line where what's in it for me. You always have to be thinking about that in sales when you're talking to prospective customers. What's in it for them? And that's exactly what you should be doing as a dentist. I couldn't agree more.
So what's in it for me when it comes to CAD/CAM dentistry? I would argue that it's, particularly if you're doing in-office milling, or even if you're not, what's in it for me from the patient's perspective, and correct me if you think I'm wrong, Dave, but we oftentimes go to like no gooey impression material, which I don't think is as powerful of a message, because it's like taking away a negative of dentistry. And what we really want to do is like bring it into a positive. And I would say when I'm communicating with patients about CAD/CAM dentistry, because we do in-office milling in my office, is that you can actually get it done in one visit. It's the single visit that's the biggest point to patients.
Quite honestly, both. I've had, I had orthodontia, and I remember having to have that gooey impression material in my mouth and choking on it and being very uncomfortable. So obviously that is, it's great not to have that. But, as you pointed out
Good
earlier
point.
in the podcast, it's, it took you 4 hours to do your first CAD/CAM tooth for me, right?
You're welcome.
Thank you. And very realistically, it still saved me time.
Oh, for sure.
And that's with 4 hours for one tooth.
And let's emphasize here again. This is 17 years ago,
Right?
Using technology that was
17 years old.
That's like the iPhone was only created like 10 years ago. So think of the way technology was 17 years ago in CAD/CAM,
Right.
in dentist. It had just turned 3D. From 2D to 3D, that's when I bought it, right? So this is, compared to like what's going on today, it's archaic. Now, that's not to say you shouldn't take 4.5 hours if it takes 4.5 hours, because like you're saying, still was a benefit to you.
Yeah, because just getting into my car to go anywhere, just the concept of getting in my car to go somewhere that's instantly a half hour here in the Twin Cities.
Yep.
Where you live, it might be more, it might be somewhat less, but let's just use that as a baseline. And then you've got half hour out, half hour back, and then to have to go to another appointment, that the appointment itself is an hour. So you're right there, you're into 2 hours of time just to conceive of starting to go to a second appointment.
And if you're one of the over 80% of adults that have some type of anxiety about going to the dentist,
Right.
doing that once versus twice is gigantic.
Right. And
Yeah.
case acceptance.
So let's that one's, and I love that you actually called me out and said that taking the GUI impression was actually a benefit too, because you're right.
Yeah.
What I would say isn't is when you start talking about margins and the technical, like, it's milling, and kind of the coolness, the nerdy stuff,
Right.
that gets down to what we care as clinicians. That's where you deviate from
Yep.
where we're going with this.
Yeah, because I don't care.
Yeah.
I care about, hey, is my tooth going to feel better?
Mm-hmm.
And how long is it going to take?
Yeah, no gooiness. That's
Right.
good.
Yeah.
One step. Good.
Right. Yeah.
It's that simple.
Right.
The next example I want to give is one that I think people can get tripped on a lot, and I think getting into this technology for me was gigantic, primarily because I don't do it myself. So it was a gigantic investment, and I had instinctively known what would make this have such a huge ROI, and that's guided implants.
Mm-hmm.
So I don't do implants. I still don't to this day. We do more and more in the office, have a fantastic oral surgeon, Dr. Patel, that comes in and places implants, and the associates are starting doing it too. But it comes down to what's in it for the patient. And I won't ask you this one because I don't think it's very obvious because you've never had one done. But the old way to do it, or maybe the way that lots of people do it today, is you go, oh, well, you're missing a tooth. Would you like to do an implant? And they go, yes. Either do it in the eye office or sending you to an oral surgeon. What used to happen for me is I would send somebody to the oral surgeon, and they would give a range of fees. Well, if we need to do a bone graft, it's going to be, let's say, $5,000. If we don't need to do a bone graft, it'll be $4,500. And if we need to do this, then it'll be that. And if we need to do that, and then there's this like, well, it's going to be between $4,000 and $6,000. And then by the way, when you come to see me, I might do this abutment based on what the oral surgeon did, or this one. So then they got another range of fees. And then people just are like the deer in headlights.
Yeah.
It's the lack of clarity.
Right.
So what guided implants to me explain what the benefit is to patients is clear planning and billing. I know what we're going to be in for before we start. Not 100% of the time, but enough to give you one fee.
Yeah.
If I can say, it really doesn't even matter if it's 8,000 or 10,000, but just clarity in your billing is what guided implants allow you to do from the patient's perspective. Now,
Yeah.
of course, getting a better end restoration, that they're going to actually assume that's always the case. Don't you agree?
Yeah. From my perspective, when I look at really everything medical, I really get very frustrated with how much lack of clarity there is in all of medicine. I had a throat culture done at a local medical clinic, and it was $450.
Oh, wow.
And I was like, I could have gone to Target and gotten this for $50, but you were closer. And they charged me $450. And so I called them up. I'm like, are you kidding me? And they're like, well, it's this and this and this. I came in for a throat culture and you're charging me $450. I'll never be back.
Yeah.
And I mean, that's insane. But to be able to offer something and be able to free patients up from that particular fear of dentistry, for me, is a huge one.
And that's that's what people complain about the most is billing.
Yeah.
When it comes to implants, I'm sure there's people who are listening to the podcast. If you're anything like me, I've screwed that up so many times where you're either eating fees because you didn't plan out accordingly, or else you're like trying to figure out a way to just give it to the patient, and then the patients get mad and leave, and it's a huge deal. For our last example, I want to focus on sort of a current passion of mine, which is teledentistry.
Yeah.
What's in it for patients and what's in it for dentists? I think that dentists, even though teledentistry, we're doing it every day in Operatory, and it's been very impactful, which means patients can upload a photo or go through a workflow where they set up a series of photos of a condition that's going on in their mouth and send it over to a provider without being there.
Right.
Obvious benefit to the dentist is that you can get appropriate amount of time for patients. You can see what's going on. So how do we explain this to patients? And what's really even more so than explaining it to patients, what are patients thinking of when it comes to teledentistry? Why do people want to actually go through the effort of sending you a photo or a video? The big thing that it comes down to is reassurance. You can reassure people, even if it's bad. You can tell them what they're in for.
Right.
And you can't diagnose with a photograph.
Right.
I understand that. But if you've been in dentistry for any length of time, you're going to be able to give a much, much more informed, educated response to a patient with a photograph than not, pretty much 99.99999% of the time.
Right.
And so if somebody has a small chip on their front tooth and it's a Saturday, before we would just go in because if they're freaking out. But if you can say to them, oh, I'm sorry, Jane, that happened. I see what you're looking at, and we're going to want to get that fixed as soon as possible. If it doesn't bother you now, though, I can guarantee you it's not going to get worse until Monday, and I'll be happy to see you 7 a.m. or whatever. So but that's not necessarily intuitive when you're looking at teledentistry and communicating with patients. Why do they actually want this?
Right. Well, and being that that's a piece of the Operatory puzzle, it's something that I speak to quite a bit. And the reassurance to the patient is exactly what they're looking for. So you have a tool to be able to get a good concept. Like you said, you can't diagnose with current technology from a photograph that's being provided by their iPhone, but you certainly can get a pretty good idea by taking a look at what patients are able to provide. And it really makes a big, big difference for the patient. It makes the patient feel so much better that you've taken at least a look at what's going on. So I think it's really appreciated by them.
Yeah, and I guess the whole point of this podcast, too, is that it's not necessarily obvious to us clinicians what the patient's perspective is.
Yeah.
And so, like we do on this podcast, ask a patient.
Yeah.
Right? If you don't know, if you're bringing a new piece of technology, I think that would be a good piece of, if you have a checklist of everything you do when you're incorporating a new piece of technology, which we can give you one on another podcast. I think that would be a great one. But on that list should be talk to a couple patients and see what's in it for them so that when you talk to other patients, you can communicate that simple and clearly to them.
Yeah, I think that's a great idea.
Thank you, sir.
Right.
And I appreciate your perspective.
Thanks, Brad.
I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Brian Laskin, host of the Operatory. Thanks for listening. I look forward to speaking with you next week.